This is Health Broadcasting Service HBS Radios, your global pioneers in specialist radio broadcasting, bringing you everything to enhance your health and well-being. Health is your human right. HBS, your partners in everything about your health and well-being.
HBS Radio is who you're looking for.
Weekly health news in review coming to you from the Health Broadcasting Service HBS radio channel. The United States Centers for Disease Control and Prevention last Friday dramatically eased its COVID-19 guidelines for when Americans should wear masks indoors, a move that means 72% of the U.S. population will reside in communities where indoor face coverings are no longer recommended. In a latter development at the time of reporting, California, Oregon, and Washington will stop requiring masks in schools after March 11, but masks will remain required in high-risk settings such as healthcare facilities, the governor said in a joint statement on Monday. We will start off this segment with checking the deaths and infections rates across the globe at this time. Germany leads the world in the daily average number of new infections reported, accounting for 1 in every 10 infections reported worldwide each day. Let us proceed with examining the infection details in Germany. But just before we do that, it is important to explain how the data is generated. Total infections and deaths for each country include both confirmed and probable infections and deaths where that data is available. If probable infections and deaths are not reported by a country, we only use confirmed infections and deaths. The data are no complete count of every COVID-19 infection and death in all countries, as the counts are based on the best available information accessible to Reuters at any given time. Countries may miss infections and deaths for any number of reasons, such as delays in processing testing data, lag in reporting, lack of testing, and so on. Some countries may exclude certain categories of infections and deaths that others include, for example, probable infections, or have different criteria as to what may be counted as a COVID-19 infection or death. Some countries change the way they are reporting to include or exclude a certain category of infections or deaths, which can lead to a significant increase or decrease in their total and what they reported previously. Against this background information, we will proceed to review the data of some randomly selected countries current at the time of this review, including Germany. At the time of this report, Germany leads the world in the daily average number of new infections reported, accounting for 1 in every 10 infections reported worldwide each day. Germany, currently at the time of this report, is at 84% of peak and falling, with 1,347 infections per 100,000 people being reported in the last 7 days, at the time of this report. With this data, Germany leads the world in the daily average number of new infections reported, accounting for 1 in every 10 infections reported worldwide each day during the past week. COVID-19 infections are decreasing in Germany, with 160,087 new infections reported on average each day. That is 84% of the peak, the highest daily average reported on February 10. There have been 14,690,845 infections and 122,670 coronavirus-related deaths reported in the country since the pandemic began. Germany's vaccination history. At least 185 countries have started vaccinating against COVID-19. Germany has administered at least 169,838,397 doses of COVID vaccine so far. Assuming every person needs 2 doses, that is enough to have vaccinated about 102.1% of the country's population. Next, we will look at Pakistan. Pakistan is at 15% of peak and falling, at 3 infections per 100,000 people reported in the last 7 days at the time of this report. Average number of new infections reported each day in Pakistan falls by more than 4,300 over the last 3 weeks, 61% of its previous peak. COVID-19 infections are decreasing in Pakistan, with 1,097 new infections reported on average each day. That is 15% of the peak, the highest daily average reported on January 30. There have been 1,509,360 infections and 30,178 coronavirus-related deaths reported in the country since the pandemic began. Pakistan vaccination history. Pakistan has administered at least 209,438,557 doses of COVID vaccine so far. Assuming every person needs 2 doses in Pakistan, that is enough to have vaccinated about 48.4% of the country's population. Average number of new infections reported each day in Pakistan falls by more than 4,300 over the last 3 weeks, 61% of its previous peak. Finally, in this section of our news coverage, we will look at Russia. The average number of new infections reported in Russia has been decreasing for 12 straight days. Russia is at 69% of peak and falling, with 637 infections per 100,000 people reported in the previous 7 days as at the time of this report. The average number of new infections reported in Russia has been decreasing for 12 days straight. COVID-19 infections are decreasing in Russia, with 131,528 new infections reported on average each day. That's 69% of the peak, the highest daily average reported on February from 15. There have been 16,291,116 infections and 721,542 coronavirus-related deaths reported in the country since the pandemic began. Russia's vaccination history. Russia has administered at least 160,816,996 doses of COVID vaccine so far. Assuming every person needs 2 doses in Russia, that is enough to have vaccinated about 55.7% of the country's population. Next, a look at the continents. Europe. Germany does not have leeway to ease restrictions more quickly, and Germans should not think that the pandemic is over as the number of new daily infections is still very high, German Health Minister Karl Lauterbach said. Sweden should have shut venues and taken other tougher measures early in the COVID-19 pandemic, though its no-lockdown strategy was broadly beneficial, a commission said on Friday. Italy reported 40,948 COVID-19 related cases on Friday, against 46,169 the day before, the health ministry said, while the number of deaths fell to 193 from 249. Americas. Brazil had 91,595 new cases of the novel coronavirus reported in the past 24 hours and 770 deaths from COVID-19, the health ministry said on Friday. Canada in December recorded its first monthly surplus since the onset of the COVID-19 pandemic, while its deficit in the first 9 months of fiscal 2021-2022 continued to fall compared with the year-ago period, Finance Ministry data showed on Friday. The United States government on Monday proposed extending temporary waivers of international minimum flight requirements at some U.S. airports through late October due to COVID-19. Asia Pacific. As coronavirus cases hit record daily highs, the Hong Kong government plans to roll out compulsory mass testing for the city's 7.4 million people in March, exacerbating separation fears among many local and expatriate families. Meanwhile, facilities for storing dead bodies at hospitals and public mortuaries in Hong Kong are at maximum capacity due to a record number of COVID-19 fatalities, the hospital authority said on Monday, as officials battle to control a surge in cases. Drug maker Shionogi & Co. has applied for approval to make and sell its oral COVID-19 treatment in Japan. This year's World Team Table Tennis Championships in Chengdu, China has been pushed back to the end of September from its April dates due to the spread of the Omicron variant, the International Table Tennis Federation said. Africa and Middle East. The Omicron BA.2 subvariant appears to be more infectious than the original BA.1 subvariant, but does not cause more severe disease, the head of Africa's top public health body said. The United Arab Emirates, the Middle East tourism and commercial hub, over the weekend ended a requirement to wear face masks outdoors and obligatory quarantine for COVID-19 contact cases. Medical developments. Patients with severe COVID-19 who develop diabetes while hospitalized may have only a temporary form of the disease and their blood sugar levels may return to normal afterward, according to new findings. Moderna Inc. executives said on Thursday they believe a 4th vaccine shot will be needed late this year due to waning protection from earlier doses. 2 doses of the Pfizer Inc. and BioNTech SE COVID-19 vaccine was protective against severe disease in children aged 5 to 11 during the recent Omicron variant surge, but quickly lost most of its ability to prevent infection in the age group, according to a study by New York State researchers. Vaccinating 70% of the population in every country in the world against COVID-19 by mid-2022 has been the World Health Organization's rallying cry to end the pandemic. Economic impact. British consumer confidence suffered its biggest month-on-month drop in February since the start of the pandemic, as people worried about fast-rising inflation, higher taxes and interest rates going up, a survey showed. Japan's industrial output likely fell for a second month in January as the fast spread of the Omicron variant disrupted car production, a Reuters poll showed. Japan's economic growth will likely grind to a near halt this quarter as coronavirus curbs and supply disruptions threaten to derail the country's economic recovery, a Reuters poll of economists showed. Italy will receive a first payment of €21 billion, the equivalent of $23.53 billion from the Next Generation EU fund to help states compensate the impact of the pandemic, EU Commission head Ursula von der Leyen said. And on this positive note, we round up this week's segment of Weekly Health News in Review. We will be back next week with another review of the week's health headlines. Remember to subscribe to the Health Broadcasting Service HBS radio channel to stay abreast of authentic global health news. Stay healthy and safe. Bye for now.
You've been watching the Health Broadcasting Service YouTube channel. Your channel of excellence and distinction. Pioneering specialist radio broadcasting. Giving you the best experience. Subscribe to our channel.